Good morning and welcome to another edition of Flathead Focus on Health. It's brought to you by Logan Health, advancing medicine and enhancing care. Mallory Pursley, she's a nurse practitioner at Logan Health Radiation Oncology in the studios here this morning. Good morning.
Good morning.
We have a brand new product that is out, PLUVICTO, and this is for someone that has advanced prostate cancer. Why don't you tell us more about that?
So there are certain stages of prostate cancer, and when we get to this later stage where the prostate cancer has actually left the prostate gland and has gone to the other parts of the body, what we call metastatic. Sometimes these types of cancers became resistant to the typical standard hormone therapy. And what PLUVICTO can do is it can actually target these prostate cancer cells based off of a certain type of PET scan called a PSMA. So it uses a radioactive particle to actually target the cancer cells and kill them.
How long has this been out and available for people?
So PLUVICTO's actually been out for several years, but only more recently, studies have shown that the person doesn't actually have to fail a round of chemotherapy before being able to pursue this. So this is to a huge advantage to these individuals. They can actually move forward with this treatment and then still have the option of chemotherapy down the road if needed. So we've been doing it here at Logan Health since 2025.
And this is something that would be brought up and discussed with your healthcare provider. Who is a candidate for PLUVICTO?
Anybody with metastatic prostate cancer that is resistant to the standard treatment of hormone therapy. And if you're at that stage, you have that conversation with either your oncologist or your urologist, and they can always refer that patient to us, and we can have that further discussion about whether or not that patient individual would be a candidate.
Well, tell us more about the treatment process of PLUVICTO as well. What can they expect during the treatment with this product?
So PLUVICTO is a course of 6 infusions, 6 weeks apart. So it usually lasts about 9-10 months for the whole thing to be complete. And each infusion is only about 15 or 20 minutes. It's done in the hospital, but it is outpatient, so you do not have to remain in the hospital. And then in between each of your doses, you have very frequent blood work monitoring. And then every couple doses, we'll do another one of those PET scans to really see what kind of response we're having.
So the results or benefits of a PLUVICTO patient is that it kills the cancer cells, or does it just slow down the process?
The main effect is that we're actually killing the prostate cancer cells by targeting them and really avoiding injury and harm to a lot of the healthy cells in the body. So over time, what we're seeing is that the PLUVICTO, by targeting these cells, is really getting rid of the prostate cancer.
So what advice or encouragement would you give to patients or families that are new to this kind of treatment option?
I would talk to your provider, whether that's your oncologist, your primary care provider. There's a lot of great information online about that, and they can always refer them over to us to have that further discussion.
PLUVICTO has a website. If you want more information, maybe you have a family member or a friend that wants more information. What is that?
PLUVICTO's website is nice because it actually has availability to help direct the closest location that is offering PLUVICTO treatments because they are not widely available. And partially that has to do with the ability of laboratories to make this radioactive particle. So it is a little bit limited, but the PLUVICTO website is great as far as differentiating who and who is not a candidate for the treatment, what the treatment itself looks like, potential side effects, and where to go for treatment.
Again, PLUVICTO.com for more information on that. Mallory Pursley in the studios here this morning talking about prostate cancer treatment with PLUVICTO. Thank you so much.
Thank you.